All right, let's go ahead and get started. Thank you guys so much for joining us today for our HIPAA Privacy and Breach Compliance in 2022 webinar. Really appreciate you hopping on, and know some folks will still be joining as we get going. Before we get started, I wanted to give you a couple quick webinar tips. Throughout the webinar today, we'll keep all lines muted, preventing any background noises. If you need to get in touch with me, please use the chat feature, accessible by clicking the chat button that shows up in the bottom middle of your screen if you move the mouse there. If you do have questions that you'd like us to address, please chat them in. Again, just send them in whenever you think of them, and we will get to them either during the presentation or we hope to have some Q&A at the end. After today's session, you will get an email from us. If you are interested in a copy of the slides, just let us know. Webinar itself should take around 45 minutes, and we're going to try and leave some time at the end for Q&A. Okay. All right, let's get going here. First, real quick, just about us here at Enterprise Health. We are a certified high trust assessor organization, award-winning e-health technology firm. Our company provides health information security products and services to assess, remediate, and monitor customers' cybersecurity risks, their regulatory compliance programs, organizational resilience, and even their third-party security posture. Enterprise Health's deep healthcare experience in both security and privacy, as well as consumer patient engagement and care coordination, gives us the ability to provide unmatched solutions to the unique challenges present in the world that we're all in, that is healthcare. Now, you're not stuck with me all day. My name's Kirk Ising, Director of Strategic Accounts here with Enterprise Health. Been around healthcare technology and services for about 14 years now. But with me, we've got the brains of the organization with Vikas Khosla and Courtney Morgan. Vikas is an enterprise, he's our Chief Digital Health Security Officer. Vikas works closely with CISOs and CIOs to advance organizations' specific and industry-wide cybersecurity, privacy, and compliance capabilities through the implementation of standards-based risk management programs and platforms. And Courtney's been in it for over 18 years now, working in the hospital and healthcare industry, passionate about all sides of healthcare, 10 years as a HIPAA compliance officer herself. She's now working with us and has received her CHIP certification from AHIMA, passionate about being an experienced HIPAA auditor. And she really specializes in all aspects there, security, privacy, as well as breach notification, which we're going to be talking about today. So we'll get in. Want to just go over real quick what we're talking about today. I know that you guys are here hopefully to learn a bunch, and that's what we're here for. So again, let us know as you have questions. But we're going to talk about a lot of the changes going on. There's a lot of talk about changes, the relaxation of the regulations for COVID that's gone away now. We're going to get into that. And we want to talk about breach notification and the audits there as well, because again, you don't just have to follow everything that constantly changes, but you have to know when and how to report. So we want to cover that as well. And then we're going to talk about how to assess your current privacy posture. Okay. So again, we're going to start off, get into this, and we want to talk first off just about some of those changes in the landscape, right? And why privacy right now? Okay, we really see a lot of pressures in healthcare right now. Two big ones that jump out to me, right? You've got COVID-19. Yes, there was the relaxation, but it's also led a lot of us organizations to adapt, more disparate work environments. HHS is also continuing its enforcement of patients' right to access, really digging in to organizations, both covered entities and business associates, looking at how you're treating the privacy and getting the information when it's appropriate to share to those folks that are asking. You know, we were talking, and Vikas and I were talking to a large organization recently. They've had a lot of different priorities over the last 2 years because of COVID, right? Security, moving the workforce in and out, remote, back. One of the things that their chief compliance officer was really concerned about is, what about my satellite organizations? In their case, they've got facilities in different states. Are they still adhering to privacy, right? Do they know what to do if a request comes in? So there's a lot of those new dynamics while there's been focuses elsewhere that they're still trying to focus in on. So we want to take a look at that and make sure that everybody's up to speed on what's been going on, what kind of changes there have been, and really dig in to privacy. when it comes to HIPAA. So we're going to do that here in just a second, but to help Courtney and Vikas as they really break in and dig into this with us all today, we want to understand who you guys are at, where you're working, what your organizations are doing. So first off, if you could just take a second, we're going to launch this poll question. Let us know where you are, right? Is it a hospital? Are you on the insurer side, a practice, a business associate, or something else that we missed there? Just take a couple seconds, and this will help us frame the discussion. All right, we'll go ahead and shut this down. Perfect. Okay, so it looks like we've got a really good mix of different organizations in that hospital space, the provider practice, business associates as well, and others. So we appreciate that. That'll help us as we go through. And then one more, as you guys are going through and thinking about HIPAA and HIPAA privacy, what are the top challenges that you see for your organization? Go ahead and pick up the top 3 out of this list and let us know what you're looking at as the challenge. All right, let's go with another, let's say 5 seconds there. Get in your final responses there. Go 3, 2, 1, we're closed, perfect. All right, so program management, lack of automation jumping out as the biggest concerns, but obviously all 5 of those are definitely concerns with the group. So that means at least we know how to pick a question, so that's good. We appreciate to know that when we're doing it right. So great, so this will help us as we go through, and again, just a reminder, as we do go through these, please feel free to chat in the questions, and we'll keep an eye out for those and answer them either in the course of, or we'll catch them at the end. All right, thank you again, and let's get started here. First off, Vikas, if you would talk with us a little bit about some of the changes and what you're seeing.
Yeah, for sure, but want to reflect a little bit on that poll question and the responses. Seems like we really hit a lot of the hot button or top priorities. I know we said top 3, but seems to be very equally distributed in terms of the 5 topics that we had. I think that just acknowledges what a significant challenge this is for the industry. And I think everybody, we're going to focus obviously primarily on the privacy rule and things that are related to privacy, but we certainly know from a cybersecurity standpoint, the pressures that the industry is in. And I think in general, what my takeaway from all the changes, and as I get to the next 4 or 5 slides when I wrap things up on my section, I'm going to bring together sort of the environment that we're in regulatorily, if that's a word. But what I'm seeing really is HHS and at the federal level, including the White House, there is a big focus on healthcare privacy and security, not only from a compliance standpoint, but cybersecurity best practices, frameworks, other things. So we really have to work together very closely and collaborate very closely. I've been in healthcare security, privacy, and compliance for almost 22, 23 years. And over the years, it's kind of been a little siloed, but certainly not only with the proposed rulemaking, but also with the trends in the industry and the onslaught of all of these, cyber activities that we're seeing and the focus on privacy that we're seeing, there is a need to collaborate closer and closer together. And to me, the changes in the proposed rule, I think will help support that further collaboration. And in fact, we see it in the rule itself. But let's look at a little bit of the timeline as we think about those you might not be tracking this as closely of where we are and where we're going relative to the changes to the privacy rule. So in December of 2020, the proposed rule changes were published by HHS, and there was quite a long period of time there for an industry to comment on it. Several extensions. The final extension was last year in May, where the RFI comment period was extended. And as we looked at, as I read a lot of those comments and talked to industry peers, there was really a lot of concern, a lot of questions, certainly things that people were looking for greater clarity on. But there are a lot of strong opinions about what should be done relative to HIPAA privacy and how it is promulgated and then ultimately enforced. And I'll reference some of that as I go through some of my topics here. Now, there is no definitive timeline for from HHS as to when the final rule will be ratified and adopted and published. But a lot of the industry is really thinking that fall of 2022, maybe later this year, after that winter of this year, might be the time frame at which this all happens. And there will probably, as it usually is, some period of time for organizations to make the necessary changes in their practices, in their processes, workflows, technologies, even in order to achieve compliance. And then somewhere in 2023, maybe even 2024 is where compliance would actually start to be enforced almost assuredly through OCR as it is currently today. But that again is a guess. We think that that's when things are going to happen. But I think it behooves all of us, and we can certainly tell from the level of interest in this webinar that the industry is really starting to think about this, and I'm glad that we're all trying to get ahead of the curve. So thinking about a little bit of why this is happening and why is it happening now, and I've read a lot, not only the rule itself, but a lot of opinions. I have my own, and then as you look and talk to industry peers, you start to see some key threads as to why this is happening. And of course, HHS and the secretaries have made their comments, but fundamentally, I distill it down to three things. They're trying to drive better care coordination and care management. That's certainly a fundamental part of it, and we'll get into how they think about that in a second. And then, of course, support value-based care. That's a major initiative from CMS. Medicare and Medicaid are those value-based programs. I'm sure a lot of you are part in some way, shape, or form of them or affected by them in some way, shape, or form. And then there is this recognition around the move towards digital health, electronic health records, and more specifically, interoperability. And I'll talk a little bit more about that as well. As we look at the goals and objectives of these changes, certainly there are things that are meant to reduce those regulatory burdens. Paper, the reduction of paper, I think is certainly, or the elimination, as we're seeing more and more over time, as paper is being eliminated through the use of email, electronic health records, online ways of securely communicating between providers and patients, a lot of information. There is this blurring of PHI and EPHI. And I think the proposed rules start to recognize that this is really sort of, you can say on the previous slide there, okay, Kirk, that this is starting to come together. For example, more and more people are using healthcare apps, some of the ones that I just described, to communicate their privacy practices and changes to the privacy practices. This is contemplated in the rule. We're also using more electronic health information exchange and interoperability. And I think empowering patients to be better informed consumers is really the key, which goes to a lot of the timelines and timeliness, and I'll get to that in my next slide. So for example, the proposed rule eliminates the requirement for a covered entity to get a signature or acknowledgement of on their MPP. Instead, they allow an individual to write, though not the requirement, to discuss that notice of privacy practices with someone at their hospital, health system, insurer, the covered entity themselves. So why is that? That's one of the things that first stuck out to me was why is this, why are we reducing or eliminating the requirement for a signature or a physical acknowledgement? Well, a lot of it goes to interoperability. We know that the TEFCA is coming into place later this year, and that is meant to support interoperability. So paper signatures, things of that nature that are not digital, really are barriers to interoperability. And some of the administrative easing of that burden, regulatory burden, really focuses in on that. And of course, we have, as we're seeing a trend in all industries, more and more focus on the individual or the consumer's right to access their own information, in this case, PHI. Care coordination is a big aspect of this as well. as we look at the rules that allow covered entities to disclose PHI to what they call ancillary and health-related service providers, such as social services organizations, ACOs, community-based organizations, home health, and various others that are involved in sort of the whole health and whole healthcare and well-being of patients. So they want to promote that ability to have better care coordination and care management of patients as well. And then there is a lot of focus on cost transparency. Quite honestly, I don't think the costs around this are going to be very significant, but providers and as well as health insurers are going to have to publish any fees associated with the release of records to individuals when they are requested. So I know that that was a surprise to a lot of patients, that they would be charged to access and obtain their own health records. So there is a focus on creating more transparency there. Kirk, go to the next slide. So going a little, sort of a level deeper relative to objectives and goals, as I mentioned before, the convergence of PHI and ePHI is certainly contemplated if you read the proposed rule. There is not only what I mentioned before, the elimination of the need to get a signature on a notice of privacy practices, but various other examples that that are sort of alluded to in the proposed rule that really acknowledge how these things are coming together. And I think we all know that all of us are using more and more electronic health records, even as they relate to issues of PHI, ePHI, whether we're talking about taking photos on our phones, whether we're talking about eFax, even those things that were traditionally considered PHI and paper are now going towards electronic means. And I think we all, see the benefit of it, but also we must have protections in place as this convergence is happening as well. The other thing that was really interesting, and this is around really specific to our provider attendees, is the release of records, health insurers as well, but to the release of records, they put a very specific timeline in the proposed rule. So, and it's a reduction to what was there previously, where you now have up to 15 days, previously it was 30 days, to provide those records to a patient. So they want more timely access and more empowerment of the patient around their health information. You can get an extension of up to 15 days, which would make the total time frame in which to provide that without falling out of compliance to 30 total days. So this sounds like this should be relatively easy to do, but I think, as we know, for especially our medium and larger organizations, this can often be a very challenging workflow and business process. So I think it just behooves all of us. We all want to provide patients this information in a more timely manner, to start really working on our workflow and business processes around those the release of information. We also talk, or the rules, the proposed rules, excuse me, also talk to the changes of how patients can request that information and broader rights to access of those particular requirements. There is a lot of information around this that can be distilled out. So I encourage people to really read the rule and or summaries of the rule around the right to access requirements, but primarily they do come down to the timeline issues and the ability to make that more frictionless in terms of access to their information and to their medical records. There's another key component to the proposed rules, which is the broader covered entity to covered entity exchange of PHI. I alluded to it previously that one of the pillars around the rule is improved care coordination. It also applies to healthcare emergencies. There's a relaxation for allowable disclosures in the case of healthcare emergencies, so that it's easier for providers to exchange that information without there being a burdensome consent process, as has been the case and has been proven to be sort of the real world scenarios for those organizations that have have experienced really issues around being able to exchange information, especially at critical moments in time in patient care. So they sought to ease the burden of that and make that less of a compliance concern while still providing certain protections. There's also a lot of talk or written language, I should say, in the proposed rule around providers and payers. So again, that focus on interoperability and care coordination comes through in the proposed rule, where there is some specificity around timelines as well as requirements relative to milestones and processes of providers and healthcare insurers exchanging information in a timely way to still get it to the patient within the timelines that are proposed in the rule. The other thing that I personally think is a really much needed and really good aspect to the changes is the inclusion of community providers within this exchange of information. And this kind of hits on those themes of interoperability and value-based care as well. It kind of brings it all together by including community providers in there. As we know, there are so many ancillary providers that are in the community that provide services in various populations, and the ability now to include all of them within the same construct and flow of information, though under the cover of the HIPAA privacy rule, I think is a really, really good thing. So that's another key piece of inclusion and broadening of the rule, which I think will be significant. But again, a challenge, of course, to healthcare providers to make sure that they are able to connect with and communicate with their community healthcare service providers and agencies. There's also, especially in the commentary in the proposed rule, there's a lot of discussion around personal health record applications, so PHRs. So the ability for electronic data transfer, and I thought this was really interesting. This could almost be something that we see changes to the HIPAA security rule coming as well, and maybe a harmonization here, where there is discussion around patient information acknowledgement, how it's becoming digital, and the ability to really make it easier for patients to be able to download this information into their PHRs or their personal health record apps. So that is, I think, some of the areas of the rule that still need to be more clearly fleshed out, and I think we'll see that in the final rule. But I thought that was a really innovative, inclusion within the changes that are being proposed. And then, of course, I mentioned before the transparency, price transparency aspect of it. That's a big theme throughout the government. So there are specifics that you can read related to posting of notices on websites and even in the healthcare apps provided by providers around changes not only to the MPP, but also any fees to the ability to retrieve records or download records as well. There are organizations that are considering that, charging patients to be able to download their health records. And I think the rule is trying to get a little bit ahead of all of that and manage that and try to make that more transparent. Kirk, let's go to the next slide. So information blocking certainly is very much related. This came out last year. The information blocking rule came out last year. And this was really meant to nudge, if you will, nice way to say it, I guess, providers to provide information, again, in a very timely way. I think it was an early indicator of the rules. It was an ability to have a separate set of boundaries, if you will, around what HHS and CMS are thinking related to sharing of information and timely access to information. They did not want to have providers, whether it's purposeful or not, and I assume most of the time it's not, prevent patients from being able to access their information. So the information blocking rule from last year as part of the Cures Act and the proposed privacy rule really go very well hand in hand, are very complementary to each other. And there are a lot of things, one point I want to make here, and Kirk, we can go to the next slide, one of the points that I wanted to make here is that there, as I mentioned earlier, there's a lot going on in this world and in this space right now, regulatory changes relative to security and privacy of PHI and ePHI. And one of the commentary that was written, or one of the responses that was written back to the proposed rule, was from the Association of American Medical Colleges, and they requested HHS harmonize this rulemaking addressing access to health data and interoperability, but include HIPAA, the interoperability rules, Title 42 of the CFR or SAMHSA or CFR, Part 2, as well in all of this, harmonize all of this to improve the ability for organizations to achieve compliance and to reduce the operational burdens that they saw from all these different regulations on providers. And I think that is really sage. And I think we see the makings of that relative to all the rules that you're seeing on the screen here over the last couple of years that were passed. And then we know that there are industry association groups, advocacy groups that are really talking to HHS and to Congress on a daily basis, really encouraging them to have greater harmonization across all of the different agencies that are involved in all these different laws and rules that are involved, as we can see from the CARES Act in 2020 to the Cures Act last year, the HIPAA Safe Harbor Act of 2021, HR 7898, which is really important in promoting the adoption of cybersecurity best practices or frameworks. That's really, really important as well. There was an executive order. And then most recently, if for those that aren't aware, something that's really important that was promulgated was the Cybersecurity Reporting for Critical Infrastructure Act that was just in March, I believe, was when it was ratified. And that requires that healthcare organizations report a breach or a material cybersecurity incident, as they call it, to CISA within 72 hours. And if there is a ransomware payment made, that needs to be reported to CISA within 24 hours. So again, this harmonization of security and privacy is absolutely happening, and we just need to continue to focus in on it and start to get prepared for these things and be very involved in the evolution of this and monitor this. And certainly as Enterprise Health, we will be doing that and talking about that more and more as the months continue forward. So with that, Kirk, I'll hand it over to, thank you. I'll hand it over to Courtney. Hopefully I'm not taking too much of your time, Courtney, but please tell us a little bit about our state-specific privacy laws.
Hi, yeah, thank you, Vikas. With the state-specific privacy laws, as you guys are probably aware, there's state stringent laws that supersede HIPAA federal regulations regarding protected health information. There are some states with more stringent regulations that supersede the HIPAA federal regulations related to PHI, which include states like California, Colorado, Idaho, Maryland, Washington, and that's just to name a few. One HIPAA regulation that many states have more stringent laws on is when it comes to patients' right of access, and that specific timeline that providers must provide patients their medical records within a specific, timeline, dates and such. And I believe Vikas touched on that earlier, where the proposed rule is to change it to 15 days. There are still some states that say that it needs to be provided upon request, or 5 days or 10 days. So just be aware of that. Another specific to HIPAA is California. They have the California Confidentiality of Medical Information Act. And that defines who may release the confidential medical information and under what circumstances, among other stringent laws. And that's just a touch on the state stringent laws that are related to HIPAA. Many states have expanded privacy laws to also include personally identifiable information, or PII, as they felt further protection of individual data was needed. And this list right here gives you an example of some of the states that have expanded privacy laws. This list also shows both CPRA and CCPA. CPRA is going to it replaces and amends several parts of the existing CCPA that focused on consumer rights and gives the consumers the right to know about the information that the business collects on them and how that information is used and shared. And the CPRA will expand and replace the CCPA effective January of 2023. Again, with this list, the Colorado Privacy Act, it was signed into law July 7th of 2021, and it will take effect July 2023. So this list is just an example of just some of the states with that have implemented privacy laws because they felt, that there needed to be more action taken. All right, can we go to the next slide, Kirk? All right, so the GDPR, General Data Protection Regulation, it was enacted in the UE in May of 2018. So it was developed in response to the growth of digital personal data controlled, collected, and processed by companies, and the increasing number of lawsuits by the citizens over mishandling and abuse of their personal data. They figured something more needed to be done. The GDPR regulation includes 7 principles of data protection that must be implemented and 8 privacy rights that must be facilitated by any organization that processes the personal data of any resident of the EU. It also requires appointment of a data protection officer, DPO. Similar roles are the Chief Privacy Officer, Chief Compliance Officer, Chief Information Security Officer, and such. And you'll actually see the numbers in those boxes below, like 290,000 are the number of US organizations required to comply with GDPR. So it's not just a few, it's a good handful of organizations. So this is something that really needs to be aware of. The value of the US export subject to GDPR, 2.5 trillion, that is a large amount. And then the maximum penalty, or 4% of global revenues, $20 million. So we're talking about large amounts that affect a lot of people. Going back to the regulations, the 7 regulations, it includes, lawfulness, fairness, and transparency for processing. The law, processing it must be lawful, fair, and transparent to the data subject. They're really focusing on the data subject rights. Purpose limitation, so you can only process data for legitimate purposes specified explicitly to the data subject when you collected it. Data minimization, making sure that you only collect and process only as much data as absolutely necessary for the purposes specified. It also includes accuracy. You must keep personal data accurate and up to date. Storage limitation, that you're only storing personally identifiable data for as long as necessary for the specific purpose. Integrity and confidentiality, processing must be done in such a way as to ensure appropriate security, integrity, and confidentiality for the data subjects, using encryption and such. And then accountability, the data controller is responsible for being able to demonstrate that GDPR compliance with all of these principles is being enforced. All right, let's go on to the next slide. All right, where we are going to talk about regulations versus frameworks. Sometimes this gets a little bit confusing, as regulations are adherence is required by law, whereas frameworks are optional. Frameworks work with regulations to create a stronger privacy posture. It helps the organizations overall. So, the HIPAA privacy rule is a regulation, and it is, important that it is followed as it is a law. The frameworks is more of a support system, and it helps, organizations follow better processes. Some examples of frameworks are the NIST Risk Management Framework, the NIST Cybersecurity Framework, the NIST Privacy Framework, and they're all complementary. And it's not one versus the other, as you can use multiple frameworks with the regulations, depending on what your organization's needs are. The NIST Cybersecurity Framework is primarily private industry, and it's set up with 5 functions, 23 categories, and 108 subcategories. And there's, primarily 7 steps that, is incorporated in that in that framework. And then the NIST risk management framework is originally primarily federal government, but it is also applicable to private industry. It's more prescriptive than the NIST cybersecurity framework, and there's 6 steps that is included in that framework. And then privacy was built to facilitate the use of both privacy and cybersecurity together, as well as guiding an organization on practices. It was constructed to enable better privacy engineering practices that support privacy by design concepts and help organizations, protect those individual privacy rights and such. Then there's also other frameworks, HITRUST, ISO 27001, ISO 27001. It's an international standard where NIST is a US government agency that promotes and maintains measure standards in the United States. Framework and standards are used for managing information and data, and ISO 27001 is leading the international standard focused on information security. So, depending on what your organization's needs, it's important to, utilize the frameworks that are available and, provide the best uses for your organization type. Kirk, all right, so let's jump over into breach notification and audits. I'm going to be covering breach notification rule. So the federal breach notification rule, it includes specifics for notification to individuals, notification to the media, notification to the secretary in the case of breaches of the individual's personal health data. So with notifications to individuals, the covered entity has to notify the affected individual no later than 60 calendar days after the discovery of a breach. And if the breach involves more than 500 residents in a prominent area, then they need to notify the media outlet serving that state or jurisdiction no later than, again, 60 calendar days. And then the notification of secretary. So if the breach involves more than 500 residents, again, no later than 60 days after the discovery of the breach. But if it's less than 500 residents, then you can actually, make sure that's documented, but you still have to notify the secretary. You just have to do it 60 days after the end of each calendar year. So you can, document that and provide it as long as it's done before 60 days after the end of the calendar year. And keep in mind, notifications by a business associate to a covered entity, that is supposed to happen without unreasonable delay and in no case later than 60 calendar days. It's important to know and get that timeline so that you can provide the appropriate notifications needed by your organization. And keep in mind, many states include more stringent breach notification rules that may include notifications to, let's say, the state attorney general or the state's Department of Legal Affairs, credit agency notifications, and possible even require crediting monitor services. So some of those states include Alabama, California, Florida, Hawaii, Minnesota. And so it's just really important to know which state-specific breach notification rules are in your state. And again, this might touch back to what Vikas covered earlier with the latest breach notification requirements that were just signed, where you have to also notify CISA within 72 hours of the breach. All right, I'm going to now pass this over to Kirk to cover the next slides. Take it away, Kirk.
Yeah, thank you. You guys are, it's always great working with folks like Courtney and Vikas and being able to dip into their vast knowledge on these topics. So I'm certainly the low man on the totem pole here, but just a couple quick things. When we talk about audit, we always talk about OCR, Office for Civil Rights. Those are the guys that do the work. They do the audits. They do levy the fines as well. But those audits can also come from state, DOJ, state attorney generals, can also get into the act, even though the OCR, the Office for Civil Rights, is who we hear about the most as their, the auditing body that the HHS uses to enforce HIPAA. And again, the OCR also levels penalties, just like state attorneys generals, DOJ can as well, depending on the violation, depending on what they find in the audit. right? And those are not insignificant. You know, you see one just recently, it was a tiny dental practice, single dentist, and he got fined $30,000, all the way up to millions of dollars of fines when it's on that broader institutional level. They tend to do a good job, I think. I don't know if good job is the right term, but they do match and to make sure those penalties are painful. Occasionally, we've seen them be practice enders, as I like to call them, but they definitely hand those out so that they are felt, depending on the size of the organization and the revenue. And of course, the big question is, what triggers that audit? You know, and there's several triggers that really get into it. The patient complaint is the most common, right? Whether it's, hey, somebody shared information with somebody they weren't, you know, I didn't want my wife to know about my medication, right? We saw that one with the Walgreens incident. But it could also be, you know, a breach. It could be a mishandling, you know, emailing the wrong information out, or it could be something in the electronic system that's hacked, ransomwares, those security incidents. There's a lot of different directions that a trigger can come from. You know, we talk about random audits. That does happen. It's still a practice of OCR to conduct random audits in addition to all these triggers. But honestly, they're really busy just with the triggers. If you guys have never seen the wall of shame, it is constantly growing. That's on the HHS site, those breaches that are reported, lovingly called the wall of shame, sorry. But again, those triggers keep coming. So it behooves everybody to be ready. You know, a lot of times what we see is folks really focus in on doing that security risk assessment that is mandated. And the privacy side, while it's mandated that you comply with it, it doesn't have that same emphasis on the assessment, but the assessment has the same benefits, right? Getting through, making sure that you are ready for that audit, like we talked about earlier with that poll question. Could you pass an audit today if you came in and got audited for privacy, patient right of access? They don't limit it to just the area that is relevant to the complaint. All your HIPAA privacy posture is under audit at that point. So are you ready for that? Right? How do you get ready? How do you manage that process? As we, again, saw the other big key point that you guys see, managing that process, managing the different pieces to it. All that's critical. We want to take a couple minutes, and I know we're getting close to the end of time because we do want to hold some for questions, but Courtney's going to walk through this, give you a feel. As Courtney's hands-on, she gets through and works on these assessments with our clients all the time. So we want to show you our methodology so you can see a path to managing the process, to making sure you have the right information and that you know what you're doing through the process. So there's some goals, right? When you do a privacy risk assessment, and I'm going to click through these quick because I don't want to spend time going through each one with the lack of time. But essentially the key is, do you know what you're doing? Do you identify the gaps, including those state stringent ones that Courtney was talking about? Do you then create a plan and execute on the plan to remediate those vulnerabilities? That's huge. We see people unfortunately go through the effort, they get the plan in place, and then they run out of steam. You've got to execute on that plan. So again, a big key is managing that process. Watching your third parties, making sure that you have the correct business associate agreements in place, and then obviously reviewing as part of this process how you're handling that data, okay? So we look at it as three main steps to the process, and we're going to walk through these quickly here, but got to gather all the information, right? Assess where your gaps are. Then you move into planning your remediation. What are you going to do, right? Making sure that you're going to bring whatever gap you found into compliance with the HIPAA, those high-tech rules. And then finalization. Make sure that everything's correct, I's are dotted, T's are crossed, and then start working on the plan, right? That's that post-assessment piece there. Get it done. Make sure that all the people that you're tasking with it are staying on task and managing that process. Not always easy, but the results are absolutely key, all right? So again, we've got these pieces, these steps that we're going through, right? Gather, plan, finalize, and then work on it, okay? So let's start here. Step one, this is where we gather the data, and I'm going to have Courtney kind of walk through this. And again, with notes on time, Courtney will kind of move through this so we can get to questions as well.
Okay. All right, so the software allows you to invite and assign multiple people to a set of questions that fit into their level of expertise. It also allows you to monitor the progress of the questions and how they're being answered. And the graph bars, as you can see, they go from red as in progress to, and they're incomplete, to green when it's complete. And then it'll also allow you to flag questions during this process, so that, you know, flag a question that still needs attention and so forth. So it's very user-friendly software. The next slide, thank you, Kirk. So right here is an example of a state stringent question. As you can see up there in the box reference 4100-CO, that is telling you that this is a state stringent regulation, and it has the state stringent regulation citation there as well for Colorado. So we do incorporate those state stringent regulations in our questions to make sure that you're covered not only on a federal level, but also on a state level. All right, next slide.
And of note too, while I switch slides, 42 CFR Part 2 is also included in these questions. Again, very similar work that we can match as you go through it.
You're right, thank you. All right, so you can answer the question yes, no, or not reasonable and appropriate. So when you answer the question yes, the platform will provide guidance on what must be provided. Many requirements are a formal policy and procedure, and in some cases, additional evidence that the processes are being implemented is requested as well. When you answer no, the platform will provide a sample template policy and procedure, and a reminder that this can be addressed at a later date, so to not hold up the completion of the project, as our goal is to complete the assessment. And then when answering not reasonable and appropriate for our circumstances, the platform will provide additional guidance to provide alternative measures or solutions that you have in place. And these are actually considered addressable by the OCR. So we do give a variety of additional information and guidance when going through the questions.
And I think it's really key here too, sorry to interject, but this breaks it down into step by step instead of just this big crazy process that a lot of us think of when we think of HIPAA and privacy, and it's so big, but breaking it down into steps is such a huge advantage as folks go through this, so they don't miss pieces. Okay, step 2, we're going to plan how to remediate. Now that we've identified the gaps, what do we do with them?
All right, so here is where you put in the corrective action plan. We call it remediation planning. The risks, if you look over to the yellow arrow on the left, it shows the risks are organized from high risk to low risk, so that your organization focuses on the higher risk levels first. The platform creates a basic threat and vulnerability and an action plan based on the way the interview questions were answered. And however, the risks are available for editing to make updates and changes to reflect your organization's specific findings using that edit button where the other orange arrow is pointed to. Right here, you will see the red pop up above saying that, letting you know any changes to the questions at this point is going to affect this area as well. So, once you get to this corrective action plan, the remediation planning, you want to keep moving forward instead of backwards. And then to edit one of the risks, Kirk, if you can go to the next slide, perfect. It drops you into this new page and it allows you to add compensating controls showing anything that the organization does have in place. We want to call that out as well. We want to make sure it's assigned to the appropriate parties, because they're going to get, auto-generated email reminders that they have something that needs to be worked on. Set target dates of when you feel the organization will need to have this risk remediated by. And you can also update the vulnerability and action plan to reflect your organization's specific findings. So, make sure you update and fix this where needed, just so that it reflects your needs. And then once that's done, you click save, and then you move on to the next one to, complete the planning phase. And Kirk?
Perfect. So, and again, apologize we're moving through this quick, but you planned it. Now you got to finalize. Make sure you've got everything in place before you sign off on that final report.
Yeah, and once it's signed off, the dashboard will look a little bit different. It reflects a grade score, graph bar showing your progress, certification of completion seal with instructions to add that to the website if you would like. And this is also where you work on the action plan. You click on there and it takes you to the action plan to work on remediating the risks. You can view the final report. And this is where you add delegates back as reviewers to allow them access to start working on remediating their risks as well. And then the action history, this is where, you know, your team will document any of your due diligence showing that you guys are working on remediating those risks. Again, the highest risks are listed first, and you go through and, you know, read what is required and, you know, provide that documentation of what is needed and what you've done to remediate this risk. And then as soon as you feel it's remediated, you check that risk remediated box and it will remove it from the action plan.
And again, absolutely key that you can really manage the process with a lot of different folks contributing, right? Because it can't be done in a bubble in most organizations. You got to get other folks involved. This helps everybody be on the same page and helps whoever's running the project to manage that and to see what's going on throughout it. Really simplifies the process.
And it might take a few, you know, a few action items before you remediate a risk, but it's important to document that, showing your due diligence and what you guys are doing to remediate that risk as the, you know, as the process unfolds.
Yep, absolutely critical to keep that documentation going. So again, that's our process. We think it's absolutely critical to take a step-by-step approach, make sure that you're not missing any of those pieces, because as Vikas and Courtney really talked about, it's complicated and it's changing. And it's becoming a greater and greater focus to make sure that as an organization, you are on top of your HIPAA privacy and how you're handling those breaches and those notifications. It all comes together to make sure that the documentation is in place and the organization and the management of the process comes together. So just real quick, if you have questions, do chat them in. You know, we want to do a quick poll question while we start letting you guys chat those in. But just, again, if you want more information, again, we'll send out that email. So if you just want slides, you can respond to that and we'll get those. I saw a couple people have requested them already. We'll make sure those get out to you. But if you do want more information, you know, let us know. We can schedule a call with you. Maybe later, if you're just here to learn today, that's great too. But let us know if we can be helpful at all. And we'll leave that open for a second. While that's open though, we did have a couple questions. In the interest of time, I'm going to get to those if that's all right. And Courtney, Vikas, a couple questions that came in that we could touch on here. And this is broad, but what are the biggest problems that you guys see as you work with folks in terms of HIPAA compliance today?
You know, and Courtney, I'll take it first real quick here. I think, you know, really it's the ability to have that central place. You know, you showed obviously a tool here from our company, but obviously there are others as well. But having a way to bring all of that together, especially I tend to work with the more enterprise organizations, and they have such a wide footprint, so many different stakeholders, many locations, various regulatory requirements, and that harmonization requirement between the security side and the privacy side and bringing it all that together, it's very, very difficult to do without having a good sort of platform in place in order to do it in today's day and age. I think there was a point in time where we could do it on paper and we could do it in spreadsheets and Word documents, but it's just so complex now and so many different factors are involved that I would say the ability to really bring it together into one unified centralized platform and have everybody collaborate and be able to go through a organized workflow, to me, it just seems like a really, really big challenge in terms of managing the program. And I think that's what we got the biggest response on in terms of the audience's challenges was program management. And that's, I think, just so difficult to do in today's complex state, you know, of our industry. Courtney?
I'd like to add training, training them, your workforce, so that they are aware of the organization's policies and procedures and the regulations in place. That's a big one for the right of access, to know that your workforce is educated and trained on when they have to provide, you know, the patient's medical records and such. So training, I think, is a big one.
Yeah, great point.
Very well said. Okay, so another question that's come in. What should we know about the relaxing of HIPAA regulations in response to the COVID pandemic?
Vikas, I'll let you take this one.
Yeah, so as we know, there was a lot made and publicized about the relaxation of certain aspects, not all, but certain aspects of the requirements under HIPAA, both security and privacy. We really fully expect that to be to end very shortly. I think officially they were talking about that April. Obviously, we're in it, but that the April timeframe of this year, where more stringent enforcement would start back up again. And if you look at sort of the latest thinking on this and discussions on this and blogs and so forth and commentary by HHS, telemedicine seems to be really the area where they're trying to make sure they continue to promote the use of telehealth, which had the largest aspect of the relaxation of rules to allow that to happen, as we all would want and expect during a pandemic. So they want to make sure that they don't slow that down while they start to ramp back up to sort of normal course of their enforcement around the rules. But really, I think we should all be in the mode now of where the rules are kind of back to where they used to be, and not only because they're looking for monetary, fines and revenue sources at the federal level, but also because of all of the breaches and all of the attacks on healthcare. It just requires us for everybody to be super diligent and try to achieve that resiliency within their programs.
Awesome. Here's one. What is the best way for folks to stay updated on any potential changes to the HIPAA and the privacy rules?
Well, I monitor that stuff a lot. Courtney, you can comment too. And I know we only have a minute left. We want to give people time to transition. But I think HHS does a really, really good job of publishing information on their website of what's going on, the latest changes. The FAQ section, I think, is really well done. I'm always looking at that. There are various industry associations that are also very much on top of what's happening. So if you look at CHIME, which is a healthcare industry organization to promote digital health, as well as AHIS, which is a subgroup or an offshoot of CHIME, which is focused specifically on security, privacy, and compliance. And I'm in fact a board member of AHIS. So you have these advocacy groups and industry associations, you have HHS, and quite honestly, Google is probably your best friend. There's a lot that people are doing like ourselves that are monitoring this very closely.
Yeah, and don't forget, like, our LinkedIn and our blogs and our webinars are also a lot of really good resource for information.
Yeah, and you can always send us a question, whether it's info or whether it's on LinkedIn to me or Courtney or Kirk or anybody else in the company. If you have any questions or anything you're wondering about, feel free to connect with us at any time.
Perfect. And with that, with time running out, really do appreciate Courtney, Vikas sharing your knowledge with us. Appreciate your insight today. And thank you guys very much for joining us and coming with us on this webinar today. Have a great day. Please reach out if you do have any questions. We're happy to speak with you anytime. Thanks again and have a great day.
Take care, everyone.
Thanks. Bye.